I would like to ask if, in thinking about this, what you all think a safe space for this kind of conversation looks like. If you ask yourselves, what would a safe space for community conversation around food allergy look like? What would that be? Because I know many of you have your own personal experiences. One thing I will do, which maybe will also be helpful for you all, is define the actual term psychological safety, which means that you're in a space where you believe that the team or the group that you're with is actually safe for interpersonal risk taking, that you are not going to be attacked or bullied or rendered invisible because you share an opinion or a piece of information that other people may not have or agree with. And so that's kind of the technical definition of psychological safety. But for food allergy folk, that might well be a little specific. And so that's why I asked. I think it's important to think from our own perspective of what we would need to feel safe. So does anybody want to be brave enough and take a stab? I see a hand. Hey, Matt, I vamped for you.
A space where it's non-judgmental.
Yes, 100%. No judgment.
Right. And culture, your whole essence is fully accepted. And
yeah, so culturally competent, somebody who's willing to meet you where you are, even if they don't know the specifics of how you were raised or where you were raised.
Correct.
Or even the language that you speak.
Right.
Yes.
A space that has both the intention of listening and working towards.
100%. So we're listening to learn rather than listening to talk and fill up our space in the conversation. Anything else?
I don't need them.
My kind of lady.
I may for the bathroom. Yeah. But I think, most of the time speaking in a safe place now with everybody, the counseling people, and you can't say your opinion without somebody like looking at the other, but we have to all, be heard, let everybody speak and then be open to other people's issues going on, opinions, and their needs too. We have gotten to the point that we're not compassionate about other people's needs and listening to other people and saying that's their opinion. It might not be mine, but it's their opinion and I have to respect their opinion. I think that's the safe place where you can, even someone with food allergies cannot be afraid to say, well, you guys, I have this food allergy. I want to go out with you if you guys can respect that.
Right.
Right. So I think that's what the safe place would look like for me.
So 100%. So what you're talking about is the idea that my lived experience matters. And so it may not match yours. You may not understand it, but you're willing to let me share it and to receive it and maybe ask me some more questions. So you're talking about empathy, about compassion, and about that willingness to just sit with the information and learn from the people who are sharing it with you. So what I'm going to ask everybody up here to do is to identify themselves and how they've worked with FAIR, because we're going to talk about how do you make a space that looks like that for people with food allergy, what they need in order to keep doing it, what they'd like to see. And hopefully, I think we're going to try this a little differently this time. You all can feel free to ask questions as we go, but we will reserve a little time at the end in case you kind of want to marinate and then think about it some more. So without further ado, Lisbeth, hand it to you.
Good afternoon, everyone. My name is Lisbeth Garcia Acosta. I am a policy analyst with the DC State Superintendent of Education, which is the state education agency for Washington, D.C. And I've been involved with FAIR for about maybe 5 years or so. I was leading the epinephrine schools program for DC and really rely on FAIR to get medically accurate information on how to identify, treat severe allergies. And in my role, I've trained staff members at schools to safely administer epinephrine and to also identify the signs and symptoms of an anaphylactic reaction, and then ensure that they have access to the epinephrine auto-injectors as well through a partnership.
I'm Viv Hernandez-Trujillo. I'm Director of Allergy Immunology and Fellowship Training Program Director of Allergy Immunology at Nicklaus Children's Hospital. And I'm founder of Allergy and Immunology Care Center of South Florida, which is a FAIR clinical network site. I'm also a mom to 2 girls, and maybe out of all the hats that I wear, I think that's my most difficult. I say that. I myself have food allergy, as do my brothers, but being a parent to 2 girls that have had life-threatening reactions is the part that maybe tugs at my heart. I'm also very passionate about the Latino population and reaching out and getting information that's not only correct and factual, but also in the primary language of the patients who need it.
Hi, everyone. My name is Ashley Goins, and I am the community health worker for Central Arkansas. I started with FARE this year, so I'm a baby food ally, but an ally nonetheless. Pretty much, I love Arkansas, y'all. It's great. Anything that I can do to help move the needle forward in the state of Arkansas, I am willing to do. I am all about community impact, and really just moving the community of Arkansas forward. So that is what I do in the realm of food allergies, which is educate, those in my community about food allergies, its importance. Yes, I'm sorry. And I have to say this. My uncle told me to tell y'all that I'm nervous so that I won't be nervous. So there you go.
We got you.
Well, I sympathize with that. I'm Matt Seymour. I'm the executive director of Mobile Care Chicago. We have 3 basically retrofitted RVs that we turned into doctor's offices, and we travel around and we provide free asthma and allergy care for people who can't afford it, or their insurance doesn't cover it, or that there's just access issues like a lack of transportation. And we've been working with FARE for about 2 or 3 years on a community health worker or a community education project to make sure people are aware that they can get diagnosed for a food allergy, and that resources for food allergy treatment are made available to people, because in most of the neighborhoods we serve, there aren't really allergists practicing besides us. So we're trying to expand access to food allergy, and then also just expand access to education as well. And our community health worker Vicky is here. So if you have any questions about the work that she's doing out in the community, which is incredible, then, we can talk afterward.
Thank you all, and thank you for being here. First of all, we talked a little bit about defining what a safe space actually looks and feels like for people in our community. And so I think, I would like maybe you start, Matt, to define what the service that you're bringing, which is creating its own safe space, allows the people who come to you to do that they wouldn't be able to do otherwise.
I mean, from my perspective, meeting people where they're at is really important, both physically, bringing a clinic out to like where people are, where it's going to be convenient for them to access care, but also accepting, and I think I heard this from your remarks, accepting people for the perspective that they have, which oftentimes is grounded in the way that they were raised, the way that they were educated, the way food allergy was talked about when they were growing up. And part of that might be based in, things that like medically we don't necessarily practice anymore, but that doesn't make them less of a part of that person's story. So being able to acknowledge where people are coming from, and then share a goal. If the goal is to manage a food allergy, then, our role is to counsel people in the best way possible, to make sure that they can accommodate the lifestyle that they want and that they get the care that they need. So, I think that's our approach.
I mean, Ashley, at ground level, you're working with individuals and, you're trying to create that space for them to have a conversation that they may not have had with very many other people. What does that look like specifically where you are? Because I think this morning, Amy was, kind enough to sort of share with us the specific challenges you have in Arkansas, which are real.
So building trust is very imperative when it comes to working in the community. And that's exactly what I try to do, is to build that trust, get to know who they are, get to know them as an individual. And then hopefully they'll open up to me about some of the challenges that they're having with food allergies. So one thing that I kind of pride myself on is knowing local resources. So for some people, if my child has a food allergy or I have a food allergy, that may not be something I can focus on if my lights are turned off or I can't pay my rent or things like that. So, just knowing those resources around and letting them know, well, hey, you know what? This place may be able to help you with that. And that way they can kind of focus on those other things that are equally important, like food allergies and the importance of that. So I really try to make sure that I'm focusing on the whole person and not just this one aspect, because yes, I'm there on behalf of FAIR, but I also want them to know that I'm there for them as well. And I didn't take the job because it was a job. I took it because I care about the people in my community. So I want them to know that I care.
You know, that level of, again, empathy, which we keep coming back to because there's so little understanding sometimes outside the community of what food allergy actually presents as a series of challenges to be navigated. I mean, Vivian, in your introduction, you talked about the fact that, like, hello, let's talk about Spanish language and what it means to create safe space for people who don't speak the language of most of the providers they're dealing with. I mean, how does that manifest where you are?
One of the beauties I really think about understanding cultural differences especially pre-pandemic, but it's happening again because it's happening a lot and I enjoy it. When I walk into a room, it's not just a single parent and a child. It's literally the grandmother, the aunt, the mom, the dad, and everyone has questions. But that's beautiful because we can create a space where everyone can ask. This happened actually yesterday with one of my fellows who came in and said, the grandmother has like 10 questions. I'm like, it's okay. That's good. She wants to help. And I looked at the mom. The mom's like, I'm sorry. So what are you sorry about? Like, it's beautiful. She wants him to be safe. So for me, that's amazing. I think the other thing in the Latino culture is to understand, and this has happened more than once. I use this phrase, safe space, frequently, but it's regarding like children and their parents. So a lot of times a teenager will say, well, this happened, and the parents had no idea that it happened. But I look at the parent and I'll say, this is a safe space. We need to listen to the story and we need to learn. And that has really been, over the years, I think one of the most powerful things. I like to use my children and myself because I've been through it as well. And I think it does help because the level of trust is what you're saying is so important. And there's a lot of mistrust for many, many reasons. And immigration status is just one of them, but there's a lot of levels of mistrust, and it's just slowly getting to know people so that they do trust and they realize this truly is a safe space. Like, I can come. During the pandemic, I had so many people with immigration status that was, different than others, and they felt comfortable coming to me because there was someone in the hospital that they couldn't communicate in the language. This is in Florida where you would think this was on the West Coast. They didn't speak Spanish. I actually intervened, and it was back then it was about COVID, but it was about someone who was dying and the parents couldn't get information because it was a young adult over 18. So it's forming those safe spaces, and I promise you can do it. This whole morning has inspired me and reminded me that it's possible and that we can do this together because we need engagement at every level.
100%. Lisbeth, you have a very particular and special responsibility in creating a safe space for minors within a giant bureaucracy. So if you can explain a little bit more about how this came to be and exactly what that means for the students and the family members.
Yes. So here in DC, there is a law, Student Access to Emergency Epinephrine in Schools Amendment Act of 2015, very long. But that law, basically ensures that students have, access to life-saving epinephrine, and also that they have at least 2 trained staff members outside of the school nurse. So ensuring that there is, added capacity. So we know nurses are sometimes very busy. So the law, came to place, based on advocacy. So it was like very, community oriented as well in ensuring that this law is passed so that students are safe. And unfortunately it was in the community report, there was a case in 2012 where a student passed away from a severe allergic reaction in a school. So that was brought into DC, and the idea is that we don't want that to happen here. So, dealing, like you mentioned, with bureaucracy is still a little bit difficult, but the main point of that legislation and our work is to ensure that students have access to undesignated epinephrine. So this regardless of whether they have a prescription or they have been diagnosed in the past or not, these, epinephrine auto-injectors are there to be used to treat anyone, even if it's a community member, staff member. And in the beginning of the program, it was, I think like very difficult to implement because schools already have a lot of different requirements, even from our own agency, who, we are the state superintendent of education. But just, there was an incident at a school where a school staff member was not too happy about the program because that meant that she had more paperwork to do and more requirements and more work, but she ended up having an anaphylactic reaction and this program saved her. So then she became an advocate and really became more, engaged with the program. So I think even with the different, barriers that we may experience because we are, not in every school. So we have connections with school staff that we train, and we also have a liaison at the school level, and they are our main point of contact. And our capacity is limited, right? But we rely on what they report to us. So whenever there is an incident, they are required to, report it to us so that then we can, order replenishment. But we cannot do it if they don't, report it. So our work really relies on what they tell us, but we try to communicate to them what are their requirements, and beyond the requirements of the legislation is the why. So the meaning behind it is to save lives, and that's one thing that we try to really point to them. And we are empathetic, and we understand that they have a lot of requirements and a lot of work in the school buildings. But this is another way that they can ensure they have a safe space for students with allergies.
One thing I will point out, and correct me if I'm wrong, Lisbeth, but I believe you are the one person administering this entire program for 200 schools.
Yeah, so I was doing this program for 5 years until April, where my colleague who's here, she joined us, and I'm gonna say your name, Fatu. Yeah, so she came on board and I passed on the portfolio to her. But really, we work to ensure that, students are safe. But again, our capacity is limited. So it all depends on what the schools report to us. And then I think working with FAIR, we have really shared all of the resources and try to connect them to, other spaces where they can get more help, because it's not just getting a report from the incident, like all of that information regarding the student name, all of that is redacted. So we don't know who the person or who the student is, but we try to share best practices during the training, share resources and ways that they can, share among the school as well, to just ensure that they get additional support besides having the EpiPen available.
So you raise a really important point, which is, how do we get people to utilize the safe spaces and then get them to what they might need? And I would love to know, maybe I'll start with you, Ashley, talking about, making this available, and then how do you convince people, what's the uptake? How do you do that?
So something I've heard a lot throughout today is meeting people where they are. So for me, when I am out tabling or I'm doing a training somewhere, I start there. I'm physically meeting them where they are, but also if they're maybe not ready to go see an allergist or they may not have time, well, the school has a clinic that you can take your child to. You don't even have to be there. We can start there. And maybe then with more conversation between the nurse or the doctor there, they'll feel a little bit more comfortable going to an allergist. So again, just meeting people where they are, I think is the best way to do that.
That's great. Matt, you have a sort of a more direct approach.
Yeah, although I'll agree with that. I think patience is really important, and recognizing that, there's understandable distrust of of institutional medicine, and that's grounded in, a history of abuse that continues even today with substandard care in urgent care centers and walk-up clinics that are understaffed and that are being run by people who are medically trained but are fairly young in their career and are not being supervised very well. So, like there are reasons why people have had bad experiences with medicine in the past and would have some reluctance to participating and spending their time going to a clinic, because ultimately, like, their time has been wasted so often. So, you just have to be present, and you have to recognize that it's going to take a lot of time, and you also have to put in the work to have conversations with people, which is what Vicki is doing, going out, making connections with community-based organizations and attending their events, and making sure that if people have questions, they have someone who's there to answer them. And then when they are ready to seek medical care, or just, become more involved in a more rigorous way, then the resources are immediately available, and that they don't have to wait a long period of time in order to get access to something that they want. So yeah, I think it's a multi-pronged approach. Like, every person is different, but contextualizing it as much as you can, and being patient, I think, is really important.
Vivian, you've spoken about, trying some things that probably were not things that were done before you arrived in a place, and thinking about how do we connect with a population that, in addition to all of this, has language issues and other cultural issues that may interfere with thinking about a potential space as being safe. So in some of the spaces you've worked in, what has worked for connecting with the audience you want to reach?
So I think I think this is from back to med school. I've participated in community fairs and in church fairs, and that's where the people that I'm trying to reach are. And it has been very helpful to take all types of materials. So whether it's, and in their primary language and at the level where they can understand it. One of the quality improvement projects that we actually did recently, we found that in our population, the patients don't really want written material. They're like of the new generation, right? They want short snippets. They want a 10, 15 second video. They almost want a TikTok on different topics.
Yep.
And we love that. It was a different disease state. We did it and it worked. We showed that it does work. So it's sometimes we may come in thinking, well, this is really what we need to do. But no, what we did was ask, how do you prefer this to come to you? How do you want the information? And we built on that. And I have found, and I think we have to obviously continue to build on it, but I found that asking what's preferred is the best way, because that's the best way to implement change, really. It is the best way.
It's so interesting. I mean, again, I think there are a lot of, assumptions that people make. You've spoken now a couple of times about young people asking you these questions. And so the fact is there is an awareness that's being created there. I mean, what are you learning from these young people who are coming to you? I'm so inspired. Amari, I'm so inspired by you. I feel that the future, and I say this, yesterday I was lecturing and speaking with med students, first year medical students, and I told them, you are the future. You are the legacy. And I did talk about food allergy, one of the cases I talk about, but they're the ones that are going to help us. I actually challenged that group yesterday. I said, you need to help be a myth buster. And it's true, right? Because everybody's an expert in something, but we are the true experts. Whether you're a patient, whether you're a parent, whether you're working in the community, you are the experts that can help. So I feel that talking about amplifying voices, it is so important to do that. And the youth are really, I just love being a pediatric allergist, immunologist. Like, they energize me. And it's true. That is how we are going to continue the hard work that we've been fighting, right? So you brought up like a big thing right here, the myths. Any of you, what are the myths that you hear from people that you are connecting with that kind of have to be, redirected, where people desperately need information? What do you hear from people that gets in the way of being able to keep them safe?
I know. One that we get sometimes when we get the incident reports from schools is, they don't take the student to the emergency room, or the parent denies transportation. And that's something that we try really hard to always point out and highlight in the training. Like, no matter, how severe the reaction was, if this was the first time, or you always need to be transported to the emergency room after giving epinephrine. So that is one that I think it's very, frequent, but also it touches on what we have talked about some other, barriers they're experiencing, like financial or healthcare. So it's also understanding why the parent denied the transportation. They are afraid of getting that bill, right? So there are real challenges that the families are experiencing, and sometimes we don't want to be like, hey, you're doing it wrong. So we try to be like empathetic and having compassion, but trying to get the message across, is really key.
One myth, that I hear a lot is, oh, I have an allergy to milk. I think someone said it earlier, when it really may be a dairy intolerance. So people are not aware of the difference. But at the same time, if it makes you feel really bad, to them, it's an allergy. So typically I don't correct them immediately. First I understand how it makes you feel, right? But then go into educating them the difference between the two, that an allergy is deadly, right? Another myth that I come across, I'm sorry guys, I'm getting nervous, but
Yes, thank you.
Another myth that I come across is, I'll put a little bit of it. If say for instance, they are allergic to, and this is a cultural thing I think I found, say for instance, a child is allergic to sage, right? But the child loves to eat dressing during the holidays. They don't want to be excluded. So mom maybe just puts a little bit of sage in it. Oh, if I just put a little bit in it, she'll be okay. No, that's not true. Right. So, just letting them know the seriousness of food allergies. And the thing about educating someone is once they know, they can go share with others. Right. So although we're planting this seed and we're planting this piece of information in this one person, it's going to pass around. So that's it. So.
No, that's huge. I mean, Matt, I think when we spoke originally, I know you've encountered this. And again, providing a mobile service means you're meeting people where they literally live and probably hearing about some of this stuff in different ways.
I'm hearing the exact same thing Ashley is hearing. Yeah, that absolutely happens where people, they'll put in a little bit either to like build a tolerance or to try to, just make sure someone isn't excluded. And it's not coming from a bad place. It's just, coming from the place that someone is at. So, I would say we see that occasionally.
So in looking at all of this, I mean, these are amazing efforts that you all have built. And, in some cases you have to lean into public policy, like with what, Lisbeth is doing, where you have to rely on the bureaucracy to support what you want to do. Or, you have this tremendous community response, that then allows you to kind of start building things. Maybe you get grants, however you do it. In terms of public policy and how it affects the spaces you're creating, what's helping, what's hurting? I see you making that face. Yeah.
I mean, I think to me the most frustrating thing is a lack of awareness on the part of maybe awareness is the wrong word, but it's difficult to see Medicaid taking food allergy seriously. In part, that's like the incentives for allergists to go practice in neighborhoods where most people are on Medicaid are just not there. So what ends up happening is that the neighborhoods that have the most resources also get the most providers, but the communities where there's a higher prevalence of allergies and asthma get no providers at all. And it's fundamentally unfair. And until CMS or state Medicaid starts feeling real pressure to make it worth the while of allergists to practice sustainably in these places, it's hard to see us making much of a difference in terms of allergy diagnosis and consistent guidelines-based treatment. So Yeah, that's the biggest thing I see, and it's a real tragedy. I mean, there's whole generations of people who are effectively locked out of medical care, and the sort of ways that people cope with those situations end up becoming the knowledge they pass on to their kids. So, yeah.
And to piggyback on that, there's solutions around some of these access allergy deserts, right? There's telemedicine, but that's also not being reimbursed after the COVID-19 pandemic. I'm one person, but I can reach a lot of people and do a lot of work with just talking to somebody that could be done in telemedicine and then executed perhaps in person much less of the time. If that could be reimbursed appropriately and frankly, should be one of the primary ways that we first access people in many areas, especially rural, then it really just needs to be a priority, but it's not. And how do we get the money? And I think Edith has a lot of insight into this as well. So I'd encourage her to say what she knows about accessing the money. Oh, she moved. She stepped out.
Oh, all right. When she comes back, but yes. Right, Belle.
Along those lines, I also think that our community health workers can help, as Matt described, as Ashley was describing, can really help to fill some of those gaps. We actually have as we mentioned, a number of our community health workers in the room. And I think this would be a great time to just have them stand up and recognize them, because they are actively creating safe spaces in their communities. So please, Ashley too.
Thank you.
So, and Anita, what I wanted is to ask, for those of you who just stood, what are your clients asking you most for? What do they come to you and say, this would really help me? That, again, we have a room full of people who are resourced, who are connected, who understand a lot of these issues. What would you like to see them be able to get more of that is, that we can help with? You want to start?
I think for me is, more of us. That's key right there, because, I have, gotten the opportunity to, do a small slides with individuals that are community health workers in different areas. And I just encounter, just 9 people. They work within the community, different areas, immigration, cancer, but for me to do a very simple presentation and they had no idea. I mean, I barely touch anybody, but it makes me happy to know that, I was able to touch different organizations, different individuals, right? And, I think we need more of me. Us. A lot of us. With what they touch up earlier, or even what you're touching up, is really, really listening and being, in their space. Cause I have the opportunities to be in this space with young individuals. I'm talking about 5th graders, 6th graders, and really know that they want to be heard, but parents are not there yet. My work just barely started. So.
Yeah. I mean, I was going to say, it's more here.
And I've learned so far that, one of them is the EpiPen cost for some, Hispanic people that come to my table. I always have a bag fixed up with all the information in their language and, everything, giveaways or whatever, but I'm always asked about the cost. They do have a large, population with food allergies, which was surprising to me. And they need help as well. And in my community, it's getting so diverse. I live in Deanwood, Ward 7, and it's so diverse now. And, so we have to have, different language papers now. Different language papers. Even in Southeast, I had the Cantonese and Mandarin, and I had those people there, and I was shocked. But that's how diverse it's getting. But I'm learning and trying to talk to more people about getting in the registry. So that's some of the things I talk about. and the rights that they have as far as the 504 plan in the schools. You have the right to advocate for your child at school and to know where that the EpiPen is at a certain distance to help save their lives. And I'm finding out that, African American women have a pineapple allergy. This is something new. So, and I've been in healthcare a long time. I was a nurse and then in public health. And so learning when I heard about FAIR and like all the research and the information, the website. And so I have to do like more. I go and do a little bit educating, then I go back and do an event. And you be on down a rabbit hole on the website. It's so much. It's like so much stuff. So I'm learning. I have to keep doing a little bit of education so I can make sure I'm making sure my asset when I do go and do my tabling or my events and things like that. So I'm learning and I try to report back what the needs really are and then I have my own advocacy of getting on the registry so we'll know and help you. And I get people like, okay, if you're this language, sign up so I can get more papers of your language, and help more people. So I'm just starting. So being here today, it's an honor. It's like I'm just taking notes. Like I got way more stuff to do.
We have more stuff to do, right? And then, yes. And Clenita's been with us for a month almost, so this may be not fully fair, but.
Hello, everyone. So, I've actually done about 3 or 4 events so far, and what I've noticed is that I get a lot of people that come to the table, and a lot of times when you do events, people are very interested in the swag that you have to give away.
Yes.
But they're not interested in that. They're interested in the information that's there. And being a community health worker, I've been, doing events for a lot of years, and I've always had the swag just disappear. But doing FAIR events, it was so exciting to see the people really want the information. So they are looking at the information. They're just like, wow. And then the other people that are vendors and that are doing their table and what they're doing, they come over and they get that information and they're like, please, can I get your card? Because this information is so important. And we would like for you to be a part of another event or fair that we're having. So that's the one thing that's happened. Every time I've done an event, my card goes and so many people are reaching out because they want to help get the information out. And, DMAS for Virginia, they asked, they add me to their newsletter because they want to get that. Yeah, it's the Department of Health. Yes. And so they were saying, this information, I was at 2 events with the ladies that was representing them, and they were like, last time I wanted to ask because this information is so important. And so just to see the people be so interested in the actual awareness and the information that's there, it's exciting for me. I'm learning so much and I'm just excited to be here.
Oh, we're excited to have you. And I hope that doesn't mean our swag isn't good enough too.
Does anyone have 5 minutes. Does anyone have a live question before I read? We have a Slido question. Mm-hmm. Who said that?
Oh, totally shocked. So, we're talking about health policy and how can health policy support more community health workers and the work that you do to be reimbursed so that there can be a steady stream to continue to support more?
Honestly, I feel as far as legislation, health policy, there needs to be a dedication to recognize this disease is life-threatening. This disease affects many, many people, and a commitment by both federally and at the state level to fund more community health workers, to fund things like we had a mobile van and we no longer have it. It wasn't in allergy immunology, but it was a pediatric van, and that is a loss to the community, right? So it's really a commitment to fund. It's a commitment to fund, because if the funding is there could be more people like all of you, and we need more people like you, and then bring back things like the things we know worked. For many years as a resident, I used to go on that van. I loved it. We went to where the people were, but we don't have that anymore, and it's a funding issue.
No, I think one thing to, what we saw this morning, and I don't remember the actual slide, Anita, but I think was it the NIH budget, like something like $47 billion for healthcare research in this country. 86 million of that goes to food allergy. I mean, it seems crazy to call 86 million a drop in the bucket, but it is. Yeah. The bottom line is that, again, what the community is asking for is more people. And you had some thoughts about this. I remember the idea that these are people who are trusted messengers.
Yes.
It would be great to recruit more people from the communities that they actually live in so that you understand, you have cultural competency. You have a knowledge of the issues that people are facing at ground level. So that's, yes, money.
And then further, that money that they are allocating, who are they allocating it for? What types of projects? How do we get, and Amazia, who is at the NIAID, is trying to influence this. How can we get work like what we're doing at FAIR, funded by the NIH, to get the implementation of the early introduction guidelines, to get implementation of epinephrine access and allergy? To improve these things, you need money. And right now they're really funding clinical trials, which are amazing, and they create things like Neffy, what I'm not saying are bad. They're amazing, but how can we get that into the community? That's what we need more funds toward.
Amy had her hand up.
I was just going to come with a corollary question. We're talking a lot about health policy and sort of what we can do. But,
yeah, pass it on. Sorry, true about
Okay, there you go. Are we on? Okay. So I was just going to ask kind of a corollary question. We're talking about what we can do for health advocacy and health policy work and all that, but someone has kind of reframed this idea of voting as a social determinant of health. And so what can we do to empower the people in our neighborhoods, in our communities to vote? Because that is again, it indicates community involvement, engagement, feeling empowered, feeling hopeful, and showing that their voice matters, not telling them how to vote per se, but saying that your vote matters because it influences who makes these policies that can then turn around and help you on the back end. So I just think that would be something that we could think about, ways to empower the people in our communities to get engaged in that way.
Well, and actually to that point, Amy, I wonder, because I think about in my own jurisdiction, do I know who the people are who are representatives that actually support these kinds of initiatives? And so that's another thing that we can do. Start asking the people that you're voting for, what is your office doing on this? Because advocacy is not always about going through Washington, D.C. It's about what's happening in your neighborhood and where are those local and state dollars being allocated. Something else?
Not so much. It's
It's the trick, Mike.
Not so much question, rather observations. One is when we're in our community, the one thing I noticed is that sometimes, I think the word was used, bullying this morning, that when people have issues, sometimes it's more of a thought of what's wrong with you. And instead the thinking from a trauma standpoint needs to be what's happened to you. And when you spoke of safe spaces, we also say a space of grace. That when we approach people, we're meeting them where they are, but we provide that grace and that support. Lastly, there is a reason I know sometimes why our community, when our neighbors in the community, they don't want the literature. Because we know, and we've discovered in Atlanta that when we're dealing with our neighbors, you're also dealing with people at a certain literacy rate. Our benefits team does everything at a 4th grade level. When I train and I teach, I do it at a 6th grade level. So we're not up here and we're not down there. But that is one of the reasons. They don't want to say that. I had a neighbor she'd come to me each week to say, like, Jan, are these beans good? And I go, let's look at the sodium content. The next week she didn't have her glasses. Each week she would bring it to me. She'd bring me something and ask me. And that's when I realized she can't read. So I'm going to meet her where she is. And I'm going to provide a space of grace. And I'm going to help her on her journey.
And just on that for a moment, on trying to provide things at an educational level, all the time I go to AI, ChatGPT. If you're not doing it, you should be. And I'll say, please give me 5 bullet points on X, Y, or Z at a 5th grade level. And immediately I get 5 bullet points on whatever it is that I need. And then the other day, although I understand it's not quite exactly, I said, please make this Spanish. and it immediately spit my 5 fifth grade bullet points out back to me in Spanish too. So, I mean, it's very helpful if you're trying to address something quickly at an appropriate reading level. We might as well use it for something everybody else is, right?
We're out of time, everybody. I encourage you, speak to everybody here about what you've heard and figure out how you can support. What can you do? Thank you.